Sri Pranam. Welcome to your today's topic, which is managing diastasis recti. So let's understand what is diastasis recti. So it's a common condition among women during post-pregnancy, and it is characterized by separation of abdominal muscles. And during pregnancy, the abdominal wall stretches to accommodate the growing uterus, and it can cause the muscle to weaken and sometimes separate. And this can create a visible gap, or also called diastasis, between the rectus abdominis muscles, which can lead to symptoms such as protruding belly or lower back pain or weakened core muscles. So it's really essential for women to understand diastasis recti and also have proper management of this, and there are exercises that can help strengthen the abdominal muscles and alleviate any kind of discomfort. So when we look at the causes of this, it's really primarily caused by the pressure of growing uterus during pregnancy. As the baby develops, the abdominal muscles stretch and separate to make room for the expanding womb. And hormonal changes during pregnancy also contributes to softening of the connective tissues, making the muscles more prone to separations. So the factors that increase the risk of developing diastasis recti also includes less exercise, overexertion during the first trimester, or multiple pregnancies, or pregnancies that were spaced quite closely. That means becoming mother too soon after delivering the child. Then the symptoms and side effects. So the symptoms and side effects of diastasis recti might include visible ridge or protrusion along the midline of the abdomen, especially when straining or engaging in certain activities. The side effect can include chronic lower back pain, urinary incontinence, constipation, pain during intercourse, or pelvic or hip discomfort, and also mental stress that can lead to low confidence and insecurity. Let's look at the prevention and management strategies. So to prevent diastasis recti, it's really important to engage in regular exercise before pregnancy and also avoid any strenuous abdominal exercise during pregnancy. And proper posture and movement techniques like avoiding rib thrusting and using correct sitting and lifting methods can also help prevent these conditions. So management strategies might include exercises that are specifically designed to strengthen the core muscles and also promote healing of the abdominal wall. So let's look at assessing the diastasis recti. So these are the various steps which I will explain in the next slide, but just to keep you hands-on, this is the figure that you can take a screenshot of just to give a quick access of how to assess if the woman has the diastasis recti or not. So just let's look at how to assess it. So as a new mother, one can follow these steps to self-assess their diastasis recti. Also, someone else can do that for them. So first is waiting for the right time. So we need to ensure that at least 6 weeks have passed since the childbirth to allow the body to heal before performing the assessment. Then we need to find a comfortable space. We can choose a quiet and comfortable area where the mother can lie down on her back. And then once she just lie down on her back with her knees bent and the feet flat on the ground and also hip width apart, we need to ensure that the legs are hip width apart. Then we need to identify the midline. We need to locate the midline of the abdomen, which is an imaginary line running vertically from the breastbone down to the pubic bone. Then hand positioning. We need to place our hands or fingers together horizontally along the midline, and then we need to start just above our belly button and perform a head lift. So slowly lift the head. When the mother will slowly lift her head and shoulders off the ground, while keeping her chin tucked. This will just come to that node where we can begin to assess. Then we need to feel for separation. So as she lifts her head, gently press the fingers into the midline and feel for the gap between the abdominal muscles. Pay attention to any soft, spongy area between two sides of the abdominal wall. So what we need to note is the width of separation. So count how many fingers fit into the gap to determine the width of the separation. For example, I feel separation of 2 fingers, width, etc. So assess the depth. Check how deep your fingers sink into the gap. So a mild separation may only allow a tip of 1 finger to sink in, while more severe case might allow several fingers to sink deeper. Then lower abdominal assessment. So we can repeat the head lift while placing the fingers along with the midline below the belly button to check for any separation in the lower abdominal area. Then we need to observe any bulging or coning. While one lifts our head, we need to observe our abdomen for any bulging and coning. And bulging or coning in the midline indicates that the abdominal muscles are not functioning optimally and might require specialized exercise. Then, if required, we need to know when to seek professional help. So if we suspect that someone has diastasis recti and they are unsure about the self-assessment results, it's essential to consult the doctor or a physical therapist. So they can provide more thorough evaluation and recommend suitable exercises and treatment based on individual condition. And by assessing diastasis recti during the postpartum and seeking professional guidance whenever needed, mothers can really take necessary steps to promote healing and also regain core strength effectively. Now let's look at exercises to avoid. So during the postpartum period, new mothers should avoid exercises that put excessive strain on the abdominal muscles and can worsen their condition. And these exercises include traditional crunches and sit-ups. These exercises can put direct pressure on already weakened abdominal muscles and can widen the separation further. Also front planks. So traditional front planks can strain the midsection. So instead, we need to practice side planks or modified planks on the knees that are more suitable in cases of these women. Then exercises that can help. So exercises that can help will be safe exercises to promote healing and strengthening the core during the postpartum period would be pelvic tilts. We can lie down on our back with knees bent and gently tilting our pelvis up and down to engage the core. Then transverse abdominal exercises. So engaging in the transverse abdominis, the deepest abdominal muscle, by drawing our belly button towards our spine without holding the breath can also be very beneficial. Then Kegel exercises. These exercises strengthen the pelvic floor muscles and also provide support to the core. So healing process. The healing process of diastasis recti varies from person to person. Some women may notice improvement within a few weeks, while others may take several months or more. What is required is patience and consistency in following appropriate exercises, which are key to recovery. There are other tips to follow. One is proper posture. So encouraging and maintaining good posture throughout the day can reduce the stress on the abdominal muscle, and also wearing supportive gear. So postpartum support belts or abdominal binders can offer additional support when engaging in physical activities or lifting heavy objects. And by understanding diastasis recti and following safe exercises and professional advice, mother can really promote healing and also regain core strength and improve their postpartum recovery. let's look at consideration for surgery. So surgery may be considered as a last resort for mothers with severe diastasis recti who do not plan to become pregnant again. This is a very important point to note. Surgery is only an option if the mother do not wish to be pregnant again. So it's really important to consult the doctor to discuss the risks and benefits of the surgical intervention and also explore alternative treatment options before proceeding for the surgery. Now let's look at safe yoga practices for diastasis recti. So incorporating yoga into the routine can be really beneficial for managing this situation. Restorative yoga offers relaxation and aids in recovery, while deep forward bends should be avoided as they might strain the abdominal muscles. Engaging with deep core muscles during yoga postures can help support the abdomen, and combining yoga with pelvic floor exercises will also promote core and pelvic health. So some of the safe exercises would be diaphragmic breathing or deep belly breathing. This breathing technique strengthens the transverse abdominis without straining the rectus abdominis. So this is beneficial. Cat-cow stretch also focuses on mobilizing the spine gently and slowly. And what we need to do is focus on our just slightly engaging the spine and not we need to avoid overarching the back just to avoid any strain. Now, child pose. This pose also allows gentle stretching of the abdominal area while relaxing the back. We can use modified bridge pose. We need to avoid lifting the hips too high and concentrate on keeping the core stable without straining the abdomen. And we can use modified side plank, where we can maintain a core engagement and avoid sinking hips or excessive dorsal rotation should be avoided. Then pelvic tilts, engaging the core without arching or straining the lower back. It can promote stability in the pelvic region. Then core awareness and functional movement. So teaching mothers about the core awareness and functional movements during the postpartum period is crucial for her recovery, especially if they have experience or they have diastasis recti. So some of the key points to address when teaching about core awareness will be these. First, explain what the core muscles are. The core muscles include not only rectus abdominis, that is front muscle, but also the transverse abdominis, which is deep abdominal muscles. So pelvic floor and the muscles along the back and sides are important. So we need to emphasize the importance of core awareness. Having a strong and functional core is really essential for stability and supporting the spine and also maintaining good posture. And then introducing Kegel exercises is also very important. So explain the importance of strengthening the pelvic floor muscles, which can be weakened during pregnancy and childbirth, is also very much essential. And then we need to teach proper Kegel technique, instruct the mothers to contract and lift their pelvic floor muscles as if trying to stop the flow of urine, and remind them not to hold their breath or tense other muscles while practicing this. Then functional movement. So focusing on everyday movements, teach the new mothers to be mindful of how they move during their daily activities like sitting, standing, lifting, or carrying the baby. So engaging the core during functional activities and using their core muscles to support their spine while performing daily tasks is also a great suggestion. Then we can advise against crunches and sit-ups and explain that these exercises can worsen the effects of diastasis recti and put unnecessary strain on their abdominal muscles. We also need to instruct the mothers to not to lift heavy objects, especially while bending, and not to lift heavy objects. And if they are lifting, then they need to do it while bending the knees and use their leg muscles instead of straining the core. Then gradual progression. So emphasize the importance of patience, and also postpartum recovery takes time, and it's really essential to progress gradually to avoiding injuries. we can start with gentle exercises, and you'll encourage the mother to begin with low impact activities like walking, modified yoga postures, or postnatal exercises classes that are tailored for their needs. Now, progression and gradual healing. So you can approach this through this. One is understanding the healing process. So you can explain that diastasis recti is a common condition during and after pregnancy, and that the suppression of the abdominal muscle is a natural part of the body's adaptation to accommodate the growing baby. And you can let the mother know that healing process varies from each mother to mother, and there is no fixed timeline for recovery. It depends on the factors like genetics, overall health, as well as the degree of muscle separation. Then, early postpartum period. So in the initial weeks after childbirth, the focus should be on gentle movements and activities of daily living. We can emphasize on proper posture and body mechanics to avoid straining the abdominal muscles. And then we can focus on encouraging of diaphragmatic breathing and gentle pelvic floor exercises to start re-engaging the core. And then from week 6 to 12, as the body continues to heal, mothers can gradually increase the intensity of their activities and begin incorporating low-impact exercises like walking, yoga, swimming. And we still need to avoid high-intensity exercises and movements that can put strain on the core, such as crunching or heavy lifting. And then after 12 weeks, with approval of doctor or a physical therapist, mothers can introduce more targeted exercise to strengthen their core and focus on exercise that specifically engage the transverse abdominis, pelvic floor muscles, and other stabilizing muscles. We still need to continue to avoid exercises that can cause discomfort or worsen the condition. And then we can continue to monitor the progress. We can encourage the mother to regularly check their diastasis recti status by using self-assessment technique to track the improvement in the width, depth, and the length of the separation. We can remind them that the progress may be gradual, and it's essential to celebrate even small improvement in the core strength. And then we can emphasize the importance of consulting to the doctor or specialized physical therapist who can provide personalized guidance, exercises, and monitor healing progress if they are very much concerned about this condition. So a professional can tailor an exercise program for the mother's needs and can help her avoid exercise that might hinder her healing. And by providing clear and practical guidance on progression and healing of this situation, mothers can approach their postpartum recovery with a lot of confidence and also make informed decisions to support their long-term well-being. Now, we also can work on the mindset and self-compassion. So we need to emphasize on normalcy here. So let her know that it's a common normal condition experienced by many women during and after pregnancy. So normalize the experience so that she understands that she's not alone in her journey. And then patience with the healing process, explaining that healing from diastasis recti takes time and it varies from person to person. Encouraging her to be patient and not to rush the process is very essential to allow her body to heal at her own pace. And then celebrating progress, so emphasizing that small steps towards improvement is worth celebrating and encouraging her to focus on progress as she makes progress rather than aiming for perfection. And then you can teach her the importance of being kind on herself and have non-judgmental space for her body and herself and her condition, and practice self-compassion. Remind her that her body has gone through a lot of changes and it's really essential to give herself grace and understanding during this recovery period. And avoiding comparison. So advise against comparing herself to other women's postpartum journey or other women's body after the birth, etc. Encourage her to focus on her own progress and growth, and rather than comparing herself to unrealistic standards. You can also include positive affirmations and she can use to work on a positive mindset as well as self-belief. Encourage her to repeat affirmations that reinforce her strength, resilience, and worthiness of self-care and self-love. And then encourage her to seek support from loved ones, family, friends, support groups, and let her know that sharing her experience and feeling can be therapeutic and also help her realize that she's not alone in this process. Then we can also work on body positivity and appreciation. So we can emphasize the importance of embracing her body and appreciating it for the incredible journey it has been through, and encourage her to focus on the aspect of her body that she is grateful for rather than dwelling on the perceived imperfection. Then remind her that gentle exercises and rest are equally important for healing and recovery, and she should listen to her body and avoid pushing herself too hard. And then celebrate any achievements that that are coming her way during this process of recovery, and she needs to focus herself beyond her physical experience and focus on things like joy of bonding with her baby, the strength that she exhibits in caring for her child, and the resilience that she demonstrates through the challenges of motherhood. And then let's look at integrating diastasis recti awareness in the postnatal yoga classes. So start by introducing the concept of diastasis recti. Explain that it is a common condition and it can affect the abdominal muscles during and after pregnancy. Discuss about the factors that can contribute to this situation, such as pressure from growing uterus, hormonal changes, and certain movements that can strain the core muscles during pregnancy. Also teach the mothers to perform a self-assessment on themselves, guide them through the steps to check the width, depth, and length of separation between the muscles, and also explain how to recognize the sign of a diastasis recti, such as a noticeable bulge in the midsection, abdominal weakness, or back pain. And then teach them to the importance of core awareness and also connection during daily activities and exercises. You can also introduce diaphragmatic breathing and pelvic floor exercises to help the mothers engage and strengthen the deep core muscles. And then discuss the safe exercises that can help strengthen the core without worsening this situation. Maybe exercises like pelvic tilts, gentle core engagement exercise, modified plank variations. And then emphasize on the importance of avoiding exercises that can cause strain on the abdominal muscles like traditional crunches or sit-ups. Then functional movement and posture. So show the mothers how to integrate core engagement and proper body mechanics into functional movements like lifting or carrying the baby or getting up from a seated position. And explain them the healing from this situation is a gradual process and it also varies from mother to mother, and encourage them to progress slowly in their exercise routine and also celebrate every small improvement in their core strength along the way, and emphasize the importance of consulting the doctor or a physical therapist if this concerns her a lot, and also if she has more questions about her situation. You can provide her information on how to find professionals who are specializes in postpartum recovery and diastasis recti management, and then work on her mindset also. So you can address about the importance of having a positive mindset, positive body image, also exercising self-compassion during this journey, and encourage the mothers to be patient with themselves and also focus on their well-being, both physically and emotionally. And also recommend that they continue to be part of supportive groups, such as maybe inside your yoga class, or if they have other community where they can openly share about what they are going through in this situation. And then remind that every step she takes towards healing and strengthening her core is a significant achievement worth celebrating. And by integrating Diastasis Recti into your postpartum education, you can empower the mothers with knowledge and tools that she needs to support her recovery and overall well-being during this special phase of her life. With that, I really hope this contributed to you, and you will contribute to many lives and many mothers to this. With that, thank you and namaste.